Speaker, a healthy Fiji is a strong Fiji, and our work to expand access to care and improve the quality of health services throughout the country is growing bigger and better, and more tailored to suit most serious health problems affecting our people. In this year's budget, Madam Speaker, we've allocated a total of $382 million to the health of the Fijian people, of which $335 million is towards the Ministry of Health and Medical Services, and $47.6 million is towards paying doctors' salaries and recruiting new medical personnel. Madam Speaker, it's well known by now that we are massively upgrading the Ba and Lautoka hospitals into world-class health facilities through a public-private partnership, and we're nearing completion on our work on the Ba hospital. Again, we'll be partnering with the FNPF on this project for the benefit of our people in the future. Under the PPP, we will engage an internationally certified hospital operator to complete the upgrade of these facilities and bring an unprecedented slate of health services to the Fijian people, including better tertiary care, oncology services to treat cancer, kidney dialysis, better maternity care for more Fijian mothers, procedures for NCDs, and for the first time ever, the 24/7 availability of open-heart surgeries. Not only for the wealthy, Madam Speaker, not only for those who can travel overseas, but for every Fijian. So real change is certainly coming, Madam Speaker, real change, impactful change, change that will save Fijian lives. The project will also provide a wide offering of new training opportunities for Fijian medical staff and put new cutting-edge medical technologies in the hands of Fijian healthcare professionals. I'd like to be clear again, Madam Speaker, this is not privatization. All of our staff will always have the option of continuing to work in the public sector. We are currently in the process of carefully selecting the right partner for Fiji on this project and have just issued the request for tender. We expect to identify that partner this year and get this important project underway. Under the PPP, the annual cost of the government is expected to remain similar to the current cost of running both hospitals. But those hospitals will be delivering more and better services to our people in a new and more sophisticated healthcare facilities environment. Madam Speaker, the health needs of our people are growing. Our population is increasing, albeit slowly, and Fijians have become more conscious of their health and keener to access medical services. That's a very good thing. In rural areas especially, we still have some Fijians making long journeys to public health facilities. So we need to make a special effort to cater for these communities. That's why, Madam Speaker, we're introducing a new program to incentivize general practitioners to set up shop directly in Fijian communities that includes peri-urban areas, towns and local communities, and rural and remote parts of the country. We want to give our people the ability to easily and conveniently see a general practitioner, to be consulted on their health, and to access basic medical services. If it's a more complex matter or serious health emergency, then Fiji should rely on the public health facilities. But they shouldn't have to make the journey and wait in line for simple health checkups and treatments. That's why we are announcing this program. We're seeking to create a new sector, a strong private GP sector in Fiji, by offering a comprehensive package of incentives that will include guaranteed income based on the number of patients they are assigned to serve, with additional financial assistance provided to GPs who set up in deep rural and maritime areas that are distance away from our public health network, whether it be Nambawalu, Sarawanga or Korabo, just to name a few examples. We'll fully roll out the first trial launch on 1st of January 2019. Madam Speaker, essentially what this means, that if, for example, a person lives in Samambula, they will have a GP assigned. There would be GPs practicing in that area. The first port of call will be going to the GP there. The cost of the consultations will be borne by government. They don't have to travel all the way to CWM or to the nearest health centre. In this way, we'll be incentivizing, Madam Speaker, GPs to set up more practices. For example, there is no GP in Korabo. There is no GP in Nambawalu. If they know they have a set of clientele base, they will go and set up shop there. This way, you'll be able to make available general practitioner consultations 24/7 even, Madam Speaker. Madam Speaker, we'll roll out the first launch, as I said, on 1st of January 2019. I'd like to specifically thank, Madam Speaker, the Asian Development Bank and the Australian government, actually, for the assistance developing this program. The Australian government, just a few weeks ago, facilitated a team of officials that went from the Reserve Bank of Fiji, the Ministry of Economy, to look at the Medicare system in Australia and how it works and how indeed we can learn from the facilities that they have there. As we've said, Madam Speaker, we've dramatically changed the 1% NTPC levy in businesses. In its place, we're also introducing 0.5% levy to fund this expansion of GPs in Fijian communities. That's going to have a big impact for businesses of all sizes, because health emergencies for employees and for their families can be managed much more quickly when there's a GP station directly in the community. And health employees are productive employees, and healthy employees are productive employees, and productive employees build strong Fijian businesses. We're changing the model of delivery for Fijians benefiting from the free medicine scheme. Madam Speaker, families who earn below $20,000 a year can access 142 essentials free at pharmacies throughout the country. What's changing is that private pharmacies will now provide medicine to recipients directly and then bill the government, as opposed to us giving them the stock. It is going to give these pharmacies a financial incentive to stock these medicines regularly and give recipients a more reliable access. Of the $60.5 million, Madam Speaker, we've allocated to capital development in the health sector. $11 million is towards the extension of the new Colonial War Memorial Hospital maternity ward. Our Honourable Prime Minister broke ground on that facility earlier this year, and once completed, it will house 200 new beds in a facility that will deliver a complete package of coordinated care specially designed for women, the first of its kind anywhere in Fiji, and built to the same standards as anything you'll find overseas. $11 million is allocated towards the construction of the Navosa Subdivisional Hospital, which will serve over 10,000 Fijians in the Navosa province and provide maternity services, pharmacy services, lab testing, along with x-rays and ultrasounds. We're providing $1 million to construct a new health centre in Londoni, $500,000 to extend the Korovo Hospital, $3 million to upgrade the hospital operating theatre and x-ray capabilities of the Lautoka Hospital, $2.5 million to the upgrade of the Valilevu Health Centre, and $9.5 million to purchase new dental and biomedical equipment, and a new MRI machine, and another $43.4 million to purchase new drugs, consumables, vaccines, and other medical supplies. All of this, Madam Speaker, will dramatically reduce the travel time for Fijians to access these essential services and new treatments. Because every minute we save for patients travelling to receive the specialised care they require is another minute of our doctors and nurses have to save the life of one of our citizens. This budget also makes a bold recognition of the critical work undertaken by community health workers in rural communities throughout the country. All of these workers will now be brought in under the Ministry of Health, some of them, for example, with the Ministry of Itauke Affairs. A new allocation of $4.6 million will go towards increasing the allowances for the around 1,800 community health workers in Fiji, from $50 a month, Madam Speaker, to $200 a month, Madam Speaker. Last year, Madam Speaker, we announced the launch of the National Kidney Research Treatment Centre, and preparatory works are underway to deliver that state-of-the-art facility for Fiji. When completed, Madam Speaker, that facility will be led by Dr. Amrish Krishnan, the only active nephrologist in the country, and many have said the only active nephrologist in the Southern Pacific in the islands. While that important work is underway, Madam Speaker, this year we will be further expanding the number of dialysis treatments available in the country and making those treatments more affordable. We've allocated $2 million to make 4 dialysis machines available at a facility in Suva and 3 more available in Nandi, which will provide dialysis treatment at $150 per session to the public. That's going to drive down prices generally for treatment, and that's going to save lives. And for Fijians with annual household incomes below $30,000, government will also subsidize half the cost of the treatment with an allocation of $3.5 million at the new standalone government kidney centers in Suva and Nandi and the center run by the Board of Visitors in Lambasa. Other facilities can be included in the subsidy scheme if they are approved by the Ministry of Health, as long as the cost of dialysis treatment is $150 or below. Madam Speaker, currently the law does not permit deductions of more than 50% from the wages or salaries of an employee. Because of this limitation, Madam Speaker, Fijians are getting seriously uninsured, as they are unable to authorize deductions from their wages and salaries for the payment of life and medical insurance. Many Fijians have simply decided to cease the payment of their life or medical insurance policies from their wages and salaries, as they have other deductions. They may have hire purchase, for example, or loan for purchasing a home. We want our people to be insured, Madam Speaker. It saves them money over the long term, it keeps them healthier, and it protects from debilitating financial mishaps. So we are going to amend the law, Madam Speaker, and exclude direct deductions for life and medical insurance and medical schemes from the current 50% restriction. And that's going to enable more Fijians to obtain life and medical insurance policies and maintain these policies through direct deductions from their wages and salaries, encouraging a culture of savings and long-term planning, Madam Speaker.